Hi, welcome to Proven Cures. I'm your host, Sarah McLeod. Today is Monday, February 24th, 2025. Thanks for joining me here. I'm smiling because I believe that this video will actually bring a ray of hope to certain individuals, specifically those who are diagnosed with a pretty dismal prognosis, having been told that their lung cancer is inoperable. This kind of cancer is deemed, it is called pleural mesothelioma. And normally what I'm finding the standard of care for this kind of mesothelioma is strictly chemotherapy. And that is because, as I said, it is surgically inoperable. What I've found in my current research is that there's actually another therapy on the market that is not chemotherapy. So when we're talking about chemotherapy, as soon as people hear that, their minds go, oh, that's cancer treatment, right? That's just normal cancer treatment. But when we really do a deep dive, not even that deep of a dive, but just a quick analysis of what chemotherapy actually is, it is a drug. It is quite functionally the use of poison to kill cells. It is a cytotoxic drug. It is not able, however, to differentiate between healthy cells and cancer cells. It kills all highly active cells. Highly active cells can be found in the mucous membrane. Highly active cells can be found in the bone marrow. Highly active cells are in the hair follicles. These areas where these highly active cellular turnovers take place are quickly decimated by chemotherapy, which is what is the cause of certain kind of side effects we see in persons on chemotherapy: mouth sores, hair loss, neutropenia, thrombocytopenia, nausea, because it has a devastating effect on cells in the stomach as well, in the gastrointestinal system. But what if I told you that there's a therapy available that sort of makes pleural mesothelioma actually operable, not with a surgical instrument, but with the use of electric fields? So listen to me. I'm actually going to share a clip of a symposium clip showing the general manager for the U.S. division of this company that makes this medical device, speaking about how it works on the cellular level, the cancer cell level. But I'll quickly explain. So the way cancer replicates, the way cancer cells replicate is through the process of mitosis. So they split apart, and they can split apart and replicate themselves every 2 to 3 hours. The way that happens is that macromolecules and organelles within the cancer cell itself have electric charges that make them highly active and volatile, and will cause one cell to split apart and become two very quickly. And this therapy that we're going to discuss today is called, it's not a fancy name at all. It can be abbreviated to say TTF. The name is Tumour Treating Fields. And what it refers to is a set of arrays, that's electrical arrays that actually dipolarize the electric ions within the cancer cell, causing them to be scattered. They're not able to function to cause mitosis. And eventually the cancer cell dies and reabsorbs into the person's bloodstream, as opposed to replicating and becoming and causing the cancer to progress and become worse. Like I said, I'm going to show a quick clip from the symposium, which will better explicate how the device works. Best thing about this device is practically no side effects. So I just described all the primary side effects of chemotherapy. This, in the clinical trial I'm going to share today, TTF was added to the standard of the chemotherapy standard of care. That was not taken away from the study participants, because that, could have potentially been dangerous to take away, what we know works. The primary endpoint, however, with TTF was to look at overall survival in these patients, and the time of survival was in fact increased after the adjuvant use of TTF, Tumour Treating Fields. So here, before I go into the study itself, listen to Mike Ambrosia, I believe is his name, the general manager for Novocure, who was the creator of this amazing device.
Division with the cancer cells, they develop certain electrical characteristics. And remember, we're dealing with electric fields, so those electric fields act on these electrical characteristics. So it turns out the electrical characteristics of the cancer cell are different than the healthy cells. And we use this low-intensity electric fields to act on these cells, and I'll show you here what I mean. And I emphasize low intensity. We're not cooking anything. It's not a microwave. You can think about certain types of your microwave is essentially an electric field that happens to act in a certain way on the molecules to heat it up. That's not what we're doing. We're at low intensity, just at a specific frequency that happens to disrupt this cancer cell division. And what happens here is, as this cancer cell is trying to divide, this is a picture of a cancer cell dividing. It wants to split into two nice little pieces there. And these lines represent the electric fields. And if any of you have ever looked at a topographic map, you know that when the lines get really close together, the hill's pretty steep and you better walk around. Well, this is the same kind of thing here, where these lines are close together, particularly here right in the middle. The field is very strong there. The field, what we call field gradient, is very strong there. So there's these organisms, these structures inside the cell, organelles and macromolecules that have electric charge. They're part of what happens in the cell division. Well, where these fields are very strong, it's pushing and pulling on these things right at this critical juncture. And that's at a time when the cell is trying to divide, so there's relatively fragile at that point. And what happens with this electric field, this cell will actually break apart. It won't be able to pull apart. And let me show you what that looks like. So here at the top is a picture of a normal cancer cell division. There are no tumor treating fields around it. And it starts out as one cell, and the H there represents hours. So in a period of 3 hours, it splits into two nice, neat little cells. Down bottom, there's two sequences of pictures for cancer cells that are in the presence of these tumor treating fields. These are, microscope blow-ups of what's happening in a cell culture dish. And you see here, as this cancer cell tries to divide, those electric fields, again, are pushing and pulling on all those structures inside the cell, and it actually breaks up into many, many pieces. And those pieces can't reassemble. They can't reassemble and live on. They'll die off and be absorbed into the body. So that's what we're actually doing, is we're preventing the cancer cell from doing what you see in the top line. So let me show you. I actually have a movie of this. Let me show you what that looks like. All right. So this movie is stop action photography. This clock is every hour. You'll see a circle here around a cancer cell that's starting to divide, and it's going to break apart into pieces. Here's a good one here. You'll see it breaks apart into pieces. There's a one right here, and just breaks apart into many pieces. There's a real good one coming up right here. And it's trying to divide, and it breaks up into all those pieces. And again, those pieces can't live on. That's cancer cell destruction at the cell culture level, and that's the science behind what we're doing. So now the question is, how do you turn that into a therapy, right? Okay, it works in the cell culture dish, but how do you turn that into a therapy?
Okay, so that was really interesting and promising information. I'm going to dive now into the study. I couldn't get the full text. I think that's something you have to purchase. But I have a pretty good abstract here, and I'll just read from it and share with you what I have available. So the title of the article is Tumor Treating Fields in combination with pemetrexed and cisplatin or carboplatin, which is the normal standard of care, right? Pemetrexed and a platinum therapy, which is either cisplatin or carboplatin, as first-line treatment for unresectable malignant pleural mesothelioma. It is called the STELLAR studies, STELLAR. I'm going to drop this information into the description underneath the video. A multi-center, single-arm phase 2 trial. It was published December of 2019 in the Lancet Oncology magazine. I'll name some of the authors. There are quite a few here, but just so you know you're in the right place if you look for this document. Some of the primary authors are Giovanni Ceresoli, Joachim Aerts, Aerts, and Rüssel Dziadziuszko. Okay. So the background now, that should be the objective of the trial. Tumor Treating Fields are a regional antimitotic treatment for solid tumors. So that's something to touch on there. So it's regional. So that means those treatment fields can actually be localized to wherever the tumor is found in the lungs using a software. So that's why they're considered regional. Antimitotic treatment, that simply means it disturbs the cellular environment. So it stops that cancer cell from breaking apart and replicating for solid tumors as opposed to blood cancer. That's the only distinction there. Which is based on the delivery of low-intensity alternating electric fields. And that's also important because a lot of times when you mention using electricity for the treatment of things or the treatment of disease or the treatment of bodily issues, people automatically assume, something detrimental, something that they saw on, I don't know, the Frankenstein movie or, something like that. But this is low intensity. So it's not meant to shock your system. I saw a separate video when I was doing my research on this, and it was found to be useful for persons with glioblastoma multiforme, which is a form of brain tumor, and is a kind of brain tumor. And the patients were given the TTF treatment in the form of sort of like an electrode scalp mask. I don't know how else to explain that. The electrodes were placed all over the head in order for the electricity to affect the cancer cells in the brain tumor. And the only reaction persons were having to that, outside of having to wear the leads, because the leads can be affected by your perspiration and maybe cause itchy dermatitis, which of course you can put a topical corticosteroid on for. But outside from that, the only reaction persons would have is it would cause a warming sensation wherever they're placed. So I say that to say it's low intensity electrical stimulation. So the most you're going to experience is slight warmth. You won't be getting jerks or jolts or anything like that. Okay, the aim of the STELLAR study was to test the activity of TT fields delivered to the thorax, the chest, in this case, of course, because it's for mesothelioma, in combination with systemic chemotherapy for the frontline treatment of patients with unresectable malignant pleural mesothelioma. So let's look at the methods. This is an abstract I'm reading from, so that's normally how an abstract for a clinical trial is written. You have your objective, your methods, your findings. So with the under methods, it says STELLAR was a prospective single arm phase. Prospective means we're looking forward to what the results may show. We are not necessarily basing this on a hypothesis, which you would find with a retrospective study. Okay, STELLAR was a prospective single arm, so we only had one, even though some persons received carboplatin and some people received cisplatin, but all of them were on one single treatment arm in terms of investigation. So if it were two arms, you might have an arm that only received the standard of care, but that was not the case here. I guess there was no need because the only other option is standard of care, right? So the treatment will be delivered by their treating oncologist. So the treating oncologist would already know what normal survival rates are with the use of just the normal standard of care. So they found that there was no need here to have two treatment arms for this study. Okay, but the results of the study were generalizable, not because necessarily the number of patients, but because the study is a multi-site study. So the study was conducted over several sites in different countries. So if you can find that patients in these different places are having the same results, the results are more generalizable than to the greater population than if a study is maintained in one place, one set of study staff, maybe with set ideas about the outcome of the investigative treatment and so on. Okay, so the study was conducted across both non-academic and academic sites, 5 in Italy, 3 in Poland, 1 in France, 1 in Belgium, 1 in Spain, and 1 in the Netherlands. For treatment-naive patients, meaning they'd never been treated with any treatment before this study, with histologically confirmed unresectable malignant pleural mesothelioma. Histologically confirmed, meaning it was probably found on MRI. Okay. Patients were aged at least 18 years of age. They had an ECOG performance score of 0 to 1. What that means, ECOG stands for Eastern Cooperative Oncology Group. It is a performance measurement for how well someone is doing in terms of activity. A lot of the times when someone is treatment naive, they are physically active. They're not their bodies are not worn down by chemotherapy. They may not be necessarily yet experiencing fatigue and these things. So a normal healthy person, their ECOG is going to be 0. They can get up every day and handle their lives. Maybe a person with an ECOG of 1, they can't do strenuous activities. Maybe it's difficult for them to walk up and down steps, but they can get up and wash up and change their clothes and things like that. So that's what the ECOG means. And the persons also were found to have at least one measurable or evaluable lesion according to modified RECIST criteria for mesothelioma. RECIST is how we measure tumor size and grade and stage cancers according to tumor size. All right, so and RECIST stands for Response Evaluation Criteria in Solid Tumors. All right, so patients receive continuous TT fields at a frequency of 150 kilohertz to the thorax and concomitant chemotherapy, concomitant meaning, as I stated earlier, chemotherapy, standard of care chemotherapy, was given along with, at the same time, TT fields were administered. With IV pemetrexed plus IV cisplatin or carboplatin for on day 1 every 21 days for up to 6 cycles. Patients not progressing after completion of chemotherapy. So as long as the cancer did not get worse, as long as it did not progress, they completed their cycles of chemotherapy as expected. They were allowed to continue to receive the TT fields as maintenance treatment. And it was only stopped if progression was found. If maybe either the patient said, okay, I've had enough of this, I don't want to do this anymore, or the physician decided it wasn't necessary anymore. Or there were unacceptable toxicity toxic side effects. The primary endpoint of the trial, like I said earlier, was overall survival. And survival analyses were done in the intention to treat population, which is all of them. And safety analyses were done in all patients who received at least 1 day of TT fields treatment. So no one was excluded from analysis in this study. So here are the findings, guys. So the study was conducted between February 9th of 2015 to March 21st of 2017, which is great. That's a really good stretch of time to look at side effects, at least primary side effects. 80 patients were enrolled in the study. If you're wondering how long were they followed up for after receiving treatment, they were followed up for 12 to 18 months. 12.5 months. So what's not, I'm looking, it says 12.5. So not 12 to 18 months. They were followed up for 17 months or 18 months. It's just the way it's written, guys, because the dot is not at the bottom of the 2. It's like in the middle between the 2 and the 5. If it's saying 12.5, then that would be 18 months. Let's just say they were followed up for 18 months. This is why I like having access to the full text, because the full text will give you a lot more information in that regard to clear up certain things. Here we are right here. So median survival was 18.2 months. And the most common grade 3 or worse adverse events were anemia. And that was in 9 patients, equivalent to 11% of the study. Now, let me say, the side effects that I'm seeing here are always attributed to chemotherapy, because as I explained at the beginning of the video, chemotherapy does not differentiate between killing cancer cells and other active healthy cells in the body. And the side effects that are mentioned are actually synonymous with side effects that occur when healthy cells in the body are destroyed. So here we have anemia, neutropenia, which occurred in 7 persons or 9%, and thrombocytopenia, which occurred in 4 persons or 5%. So all of these side effects, just from my experience in cancer research, are attributable to the actual standard of care therapy. Skin reaction was the only adverse event. It says it explicitly now. Skin reaction was the only adverse event associated with TT fields and was reported as grade 1 to 2 in 53 patients, approximately 66% of the patient population. And it was also reported as a grade 3, which means the irritation was a bit worse, in 4 persons or 5%. No treatment-related deaths were observed. Awesome. interpretation now. So the trial showed encouraging overall survival results with no increase in systemic toxicity, which is amazing. TT fields of 150 kilohertz were delivered to the thorax along with pemetrexed and platinum as an active and safe combination for frontline treatment of unresectable malignant pleural mesothelioma. I wish, guys, I wish I had the full text in front of me so I can see some more background information in terms of was the cancer found to be destroyed completely in certain persons. What was the overall survival rate compared to maybe the expected survival rate with standard of care? The study is really, really promising though. And if this is something that you or your loved one may be interested in, this is definitely something to take to your oncologist for discussion. The company who provides TT fields is called Novocure. That's Novocore. If your oncologist is not aware of TT fields but is willing to work with you on starting therapy, maybe you'll have to contact Novocure depending on where you're at in the country, because I know that they are active on the East Coast of the United States, the Northeast specifically. But depending on where you are, you may have to dig a little bit in order to be able to start treatment. But this information is definitely worth knowing. If someone in my life suffered this way, I would definitely try and find out about these TT fields. And also, it is a cancer cell destroyer with minimal side effects to the patient, which is, the total opposite of chemotherapy in regards to toxicity. It's been found, like I said, to be useful for the treatment of brain tumors. I'm just sharing the information. If this is something that's really important to you and you want to find out, once again, the name of the company is Novocure. Touch your oncologist, they'll probably already know about it. And if not, you may have to do some searching for yourself. But anyway, thanks for watching. I hope you found this helpful. You can always leave notes, comments, what have you. They are welcomed here. And until next time, bye. Oh, I always forget to the end, right? Like, share, subscribe. Like, share, subscribe. Thank you. Bye.